Take it away.
Okay. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Tasha Sizemore, and I welcome you to this public hearing to discuss the division's preliminary rate decisions for 2023 health benefit plans. The division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the division's preliminary decision and final objections regarding this filing. During the hearing, carriers will provide information on their plans, including network and benefit changes, and are permitted to defend their rate assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose revised assumptions at this time. When reviewing a rate request, division's actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios. That's how much of every premium dollar goes to pay healthcare claims cost to ensure that the requested rate is not projected to trigger federal rebates or payments from other federal programs. The recent history of rate changes and the overall financial strength, including profitability, income investment, and surplus of the company and administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine if the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all of these companies on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the rate review period, are posted as well. In this hearing, we are discussing in this order the preliminary rate decisions that the division has made on individual and small group as it applies to Regence, but health benefit plans filed by BridgeSpan Health Company, Regence Blue Cross Blue Shield of Oregon, and later we will be discussing Samaritan Health Plans, Inc. Our agenda for this morning will be representatives from each company will make a presentation and describe their rate requests. Next, division staff will lead a discussion about the division's preliminary rate decision on each filing and the preliminary decisions. Finally, we will accept public testimony. If you would like to make a comment on a company's filing, please unmute, introduce yourself, and make comments and make your comment. Comments will also be accepted online at our website through 11:59 on January 28th. The division will make final decisions about these rate filings shortly after the public comment period ends on July 28th. Okay, BridgeSpan. I think at this point we can quit sharing our screens, and BridgeSpan, you can take it over and introduce yourselves and explain your rate requests.
Perfect. The sharing work appropriately?
Yep, it looks like it.
Great. Thank you, Tasha. So I'm Dan Bader. I'm an actuary employed with BridgeSpan Health, and I'm here to present our rate filings for 2023, the individual line of business. So for 2023, BridgeSpan has requested a 2.3% rate change. We have no changes to our networks or product portfolio, as we only offer the standard plans, and any plan modifications were those required with the standard plans to meet AV requirements and such. The main driver of the rate change is the increasing cost of medical care. And given that it's a pretty simple rate filing this year, that is the extent of what we have to share. You can connect with us on various social media platforms.
Thank you. Is that all you have, BridgeSpan? Anything else about your rate filing?
Nope, that's it. I hand it back to you if you have any questions.
Perfect. Okay, thank you. Now, division staff will lead a discussion about the division's review of the filings and the preliminary decisions. So, actuaries.
Are we going to go through introductions first, or?
Oh, yes, Ethan didn't have that. Sorry, everybody. I'm standing in for Ethan as MC. So, yes, division actuaries, please introduce yourself.
Hi, my name is Drew Bucks. I was the primary reviewer for the BridgeSpan filing.
Okay.
Hello, this is Tim Hinkle. I was the secondary reviewer. Thank you.
Okay. So for my presentation today this morning, I'll get started with a high-level overview of the process that we go through for these filings. That was a very quick overview from the BridgeSpan side, but I'll just go into a little bit more detail for our process. And then I'll get into some details of the more important factors of the filing, and then I'll wrap up with a recommendation for this filing. So the high-level review, we focus on three categories: the data and the experience, the assumptions, and the calculations. And so for the data and the experience, this kind of serves as the starting point for the rate build-up to get to 2023 projection period. And we review the data and the experience for the appropriateness and reasonability. For this year's filing, the data that was used was from calendar year 2021, and this serves as the base period. One of the important parts of the data and experience is the credibility. And so for BridgeSpan, which has low credibility, this was blended with Regence. This is a common practice, and we reviewed the supporting documentation and found that it was acceptable. And so after reviewing the data and experience, we found no issues. Moving on to the assumptions, these are used to adjust the base period data up to the projection period. Again, we reviewed for the appropriateness of the usage and reasonability of the values and magnitude. And some of the important assumptions include trend, reinsurance, risk adjustment, among others. I'll get more in depth on these in a few moments. And the third part is the calculations, which takes the data and the assumptions and creates the 2023 rates. Again, we review for the appropriateness and accuracy of these calculations, and after review, we had no issues. And so now moving into the second part, the important assumptions. The first major assumption that we look at is trend, which is made up of the medical inflation, which is cost and utilization. This is the majority of the trend, and then there's also a prescription drug. We reviewed the trend assumption itself for this company and compared it to other carriers in the market, and found that it was acceptable within the range of other carriers. The next assumption that I'll talk about is reinsurance. We have a state reinsurance program which creates a pool to help cover high cost claims for Oregon members with any company. And so we added up the reinsurance receipts in aggregate from all companies. It was very close to our target, so we have no changes for this company. The risk adjustment is another mechanism to help stabilize the market, dealing with morbidity of the market. And this year we actually had a chance to review the final numbers from CMS for 2021, and as did the company. And they were making no changes to their projection, and we also accepted their projection as they gave it to us. And one other part that I just want to mention, since the base period data was in 2021, which would include some COVID experience, there was a slight adjustment down to reduce some of that utilization from 2021 to 2023 projection period. And so we reviewed the supporting documentation and found that it was reasonable for the company and within a range of the market-wide assumptions. And so finally, we propose to approve this filing as filed. I'll pause for any questions.
Thanks, Drew.
Okay. Thank you, Tasha.
BridgeSpan, do you have any additional information or comments that you would like to make on these filings?
Nope, just appreciate the time that Andrew took to review the filings.
Thank you. Okay, we will now take any public testimony. Please unmute and introduce yourself. I don't think we have anybody, but making sure. No one has signed up to testify. So let me just remind anybody listening that July 28th is the last day for public comments. Comments can be submitted through our website at OregonHealthRates.org. Thank you. Next, we will hear from Regence, and we will pause briefly. Steve, let me know when you're ready.
I think you can go.
Okay. Okay, thank you. Regence, I believe you have a slideshow for us as well, so I will turn it over to you.
Thank you. I'm Lisa Mudgett. I am an actuary at Regence Blue Cross Blue Shield of Oregon, and I'm joined today by Logan Mealy and Dan Bader as we talk about our 2023 rate filings. We're glad to be here today. We're all calling in from our Portland office on this beautiful morning. Happy to have been in the area for over 100 years and served nearly 1 million people here. We are requesting for individual a 4.6% rate change and a Q1 7.3% for small group, with the main driver of the rate changes being the cost of medical care. Logan?
Thanks, Lisa. Again, my name's Logan Mealy, and I'll be speaking to both the 2023 Regence individual and small group plan changes. Starting off with individual, we're requesting an average annual rate increase of 4.6%, as Lisa had previously stated. And in 2023, the OHSU Health Network is being eliminated from Regence's portfolio, which has resulted in the discontinuation of all the OHSU plans you can see listed there on your left-hand side. Despite discontinuing the OHSU Health Network, OHSU does continue to serve our members through our individual and family network. And in addition to the OHSU plans listed, there's also a few virtual value plans that are also being discontinued in 2023. While there will be these changes to our networks and individual plans, our service areas, covered benefits, and also our commitment to serving Oregonians remains unchanged. Flip to the next one. All right, for small group, we are requesting a 7.3% increase, as Lisa also previously stated. And for 2023, there are no discontinued plans and no changes in covered benefits. Our service areas remain unchanged, and there are also no proposed changes to the provider networks in 2023. Lastly, there will be one addition to our small group plan portfolio in the Platinum 850 preferred plan. This is a high value plan offering that we believe sets us apart in the market. And one major benefit of this plan is that it takes all the guesswork out of healthcare finances, as our members will just be paying the premiums and the $850 deductible, and then their care will be covered at 100%. Next slide. So we do not have TikTok, but if you would like to connect with us here at Regence, please feel free to use one of the listed social media platforms. And that's all we have. Thank you.
So I just want to acknowledge that we did have somebody mention that no audio is coming through. I heard you loud and clear, Cambia, and thank you for that presentation. I wanted to see, though, if the audio has improved by any chance. Is anybody else experiencing audio issues? Or can everybody hear me okay?
I can still hear
I can hear you.
Loud and clear.
Okay.
Everybody sounds good.
Okay, perfect. Just making sure, because that was a really good presentation. Okay, thank you to Regence. Now I'm going to turn it back over to our actuaries, who will lead a discussion about the division, about the filing review and the preliminary decisions.
Hello again. Okay, good. So I'll go through our process a little bit quicker this time, since it's the similar one we have for BridgeSpan. Our overall review process starts with the data and experience, the assumptions and the calculations. And so for the data and experience for Regence, the credibility is 100%, so there wasn't any blending with BridgeSpan or any other source. After review, we had no issues with the data and experience that was used for Regence. The assumptions, the trend, reinsurance, and risk adjustment are some of the major assumptions that were part of this filing, and I'll get to those in a moment. And the calculations, again, are what take the data and assumptions to create the 2023 rates. And after review, we had no issues with the calculations. Switching to talking about the assumptions now, the trend, again, made up of medical inflation and prescription drug. We compared Regence assumption by itself and to others in the market and found that it was within an acceptable range. Reinsurance, which applies to individual only, again, we added up the reinsurance receipts in aggregate from all companies in our market, and it was very close to our target, so no changes there. Risk adjustment, the 2021 risk adjustment numbers from CMS were released. We reviewed them as well as the company and have no adjustments to what the Regence is showing. And then finally, the COVID factor, which is, again, just a slight change from the 2021 base period to the 2023 projection period. And so we propose to approve as filed. I'll pause a second for any questions, and if not, move on to the small group. And so for small group, the process is exactly the same in terms of the three parts: the data, the assumptions, and calculations. But the data and assumptions themselves will be specific to small group. The calculations are mostly similar. We had no issues with the trend or risk adjustment that was used for the Regence small group filing. And so that leads me to the proposed to approve as filed for both filings.
Thank you, Drew. Regence, do you have any additional information or comments that you would like to make about these filings?
Nope, not at this time. Thanks for inviting us today.
Yeah. Okay, now we will take any public testimony. So please unmute and introduce yourself if you would if you'd like to provide any testimony. Okay, no one has signed up to testify, so please let me remind anyone listening that July 28th is the last day for public comments. Comments can be submitted through our website at OregonHealthRates.org. We're going to pause briefly now to get the next carrier set up. Thank you, Regence and BridgeSpan staff for coming today.
Thank you.
Thank you.
Thank you. Bye.
Okay, do we have somebody from Samaritan